My name is Dr. Uzair Hammad. My residency is in neurological physical therapy rehabilitation, and I'm completing it with the University of Central Florida here in Orlando, along with Orlando Health Regional Medical Center, the hospital. I always knew I wanted a career in healthcare, but I couldn't figure out which, direction or exact path I wanted to pursue. I think it was my third year of undergrad where I learned about the PT profession for the first time. And prior to that, I had been observing pediatric surgeons, MDs, all the different disciplines. And I found myself trying to convince myself to pursue healthcare at that point, I remember. But when I learned about PT and I started observing PT sessions, I felt a lot more connected to the patients and felt a calling to pursue PT. So that's kind of what brought me to the profession. But choosing a practice area was actually the harder part, I've realized. So through PT school, I exposed myself to as many different settings and populations as possible, whether that was through clinicals and other PT school experiences. And I found out that I loved all of them. And so they all had something unique to offer me in terms of fulfillment through service, which is what brought me to the profession. But my final clinical in PT school ended up being in inpatient rehab for the neurological population, actually, where I'm completing my residency right now. But I remember during that clinical, just I can't describe what I felt or feel even now when I treat this population, but I feel like I get to be their go to person, so to speak, after a devastating event. And the concept of helping them get their life back literally step by step just instills this inner drive and passion in me to get up in the morning. So realizing that caused me to specialize in neuro. So I actually completed my DPT at the same place where I'm doing my residency right now. So the University of Central Florida. That's also where I went for undergrad. So go Knights. But it would in August of this year, I would be a practicing PT for officially a year. So that's kind of cool. But the third question, why did I choose a residency? So my drive or decision to start a residency came from wanting to ensure that I do right by my patients and serve them to the best of my abilities. And I didn't want it to take 10 years for me to get there. Um, Additionally, one thing I've always considered is starting my own practice or organization of some sort. And I remember realizing that I obviously wouldn't be qualified to do something like that and serve to the capacity that I want to if I was just a new grad without any experience. So, partly doing residency also was to help me become an expert quickly and to accelerate my growth. Out of all the different residencies out there, I definitely was more attracted to the ones that offered a didactic component or an opportunity to be involved in teaching. But additionally, I really spent a lot of times reading and researching the individual mentors, which would be helping me throughout the different settings, as far as their areas of expertise, their qualities, and the visions they have for the profession and why they joined it in the first place. And I definitely wanted to be somewhere which kind of provided me a team type of environment and feel. So during interviews is kind of where I guess I assessed that. But all in all, I think it was the mentorship. So the residency where I'm at right now, I really valued the mentors and felt like they would have a lot to offer me, which aligned with like my own personal values, and it's been great. So opportunities wise, I've been able to do things I wouldn't have otherwise had the chance to do so early on, um, including things like hosting numerous CEU webinars through the FPTA, during conferences, even such as Assembly of Representatives. I've been invited to clinics in the area to provide education and training to staff and other professionals. which to me, as new as I am, is like, what? But so that's, pretty cool. And I've developed my teaching and presentation skills significantly throughout the start of this journey. And since I'm also an adjunct faculty at UCF as part of my residency, I've been able to practice that there as well. But I feel like just pursuing a residency has put me in the right spotlight, so to speak, because others know I'm serious about and devoted to what I do. So even my mentors, I've realized, consider me a colleague with a high level of experience just because I'm a resident, and which has led to them offering me opportunities such as like being a co-host on the ANPT podcast for the spinal cord injury SIG. So a bunch of cool opportunities, which I definitely wouldn't have otherwise I've gotten or pursued, had the confidence to pursue even. I've definitely enjoyed the growth I've seen in myself and the confidence I've developed in teaching, treating complex patients, and just that aspect of everybody in my residency is trying to help me grow and flourish as a young professional, is how I see it. I definitely wasn't the most confident, or I was not the person to be the first to raise my hand to go present something or share what I my thoughts and things like that. So it's definitely been cool seeing that now I am that person that, it's going to be fine no matter how nervous you are. So that's been something I enjoy. Um Even throughout residency, if something cool or interesting comes up, everybody automatically goes, "Oh, where's Z? He's got to see this." So, all of that's been super awesome. The challenges I've undergone, this has definitely been the most rigorous year of my life, I would say. I joined right out of PT school, so there wasn't much of a break before starting, but I kind of planned it that way going in because I figured I still have the discipline and, just the whole routine of being a student, so I might as well continue now. But not only did I learn to have to become an independent physical therapist straight out of school, but I had to do it in like an accelerated mode with additional lectures and meetings and opportunities only a resident would undergo. And although all those things are super valuable, just going through them all has definitely been the most challenging part. And accepting myself as an expert has been surprisingly challenging as well. For people considering a residency program, my main piece of advice would be to really spend time asking yourself why you want to pursue a residency. So, spending that time as far as like your personal why for a residency specifically, so that you develop a strong foundation, which will help you get through the residency itself. Um, don't just do it because your professor is telling you to or because you think it'll look good on a resume. You really have to know why you want the residency training specifically. Qualities that make a successful resident, I think my main one would be willingness to receive constructive criticism and feedback would be essential. That's kind of the whole point of a residency. And I know that, I mean, even myself, as someone that has always been open to constructive feedback, because I realize that those things will only help me grow and get better. It's hard when you're a resident and you're always just being pushed to be better. So just knowing that going in and really, I guess, keeping it on the forefront of your mind that whatever criticism you are getting is to help you get better. So just not forgetting that. Um, I kind of treat them like nuggets of gold being thrown at me. So when they first hit me in the face, they kind of hurt. But if I'm willing to look at the floor, all of a sudden I see something very valuable at my footsteps, like a piece of gold. And then I can, do something with it. Once again, I'm going to go ahead and say get started with getting their why established. Just because when you spend the time to really figure out why you're doing something, you just let it be, you let it simmer, you write it out, you just think about it. Then when you have to write the little short answers and everything on the application, you'll be able to speak from your heart a lot more versus trying to write what you think they want to hear or something generic. You're actually able to speak from your heart. Before the interview, I would definitely suggest you do some prep work. You should know why you want to do a residency, of course, but also where you're applying specifically. Spend some time drafting out example answers to questions you might be asked, even. So you can Google common physical therapy residency questions and just practice answering those. And although you likely won't get the same exact questions on interview day, you'll still have sorted through your thoughts and you'll be able to deliver your answers in a concise and effective manner on interview day, just because you would have already gotten in that frame of mind. Personally, I recorded myself answering these questions just to see what my body language even looked like before the interview, just to because you don't know how you look or sound until you kind of watch yourself, and that's why it's awkward when you're watching yourself speaking. But for the actual interview, during the actual interview, be confident. You got offered the interview for a reason, so they believe in you. You need to believe in yourself. They aren't looking for a PT student anymore, and you're not a PT student anymore. So have confidence in that. You've earned your right to be sitting there. And a lot of residencies ask you to provide clinical questions and answers to clinical scenarios, whether that's through a case study or what have you. I recommend you always refer back to the best evidence, especially as a first year out of PT school trying to apply to a residency, which is very competitive. I didn't have a lot of clinical experience, but by using the best evidence available, you can't go wrong with that. So I would definitely suggest that if you're starting out. And most importantly, be yourself, because people will always remember, they will not remember what you said during these things, but they will definitely remember how they felt when you spoke. Well, I've only been out for a year, as I said, but when I started my DPT journey, direct access, for example, wasn't even a thing. Neither was dry needling, and things like cash brace practice was pretty much an unheard of idea. And all these things started to get developed in the 3 short years I was in school, which was super encouraging to see happen as a student getting ready to join the workforce. So we got direct access in Florida while I was a student. Dry needling was improved. I've seen a lot more people open up their own practices, what have you. And I always said to my classmates that I can't wait till we graduate and get to contribute the great ideas we always talked about in class to the actual profession. And it's been pretty cool to see it actually happening. So there's so many young PTs who are graduating and are so passionate about what we do. And you have new grads educating the population on scale in such a creative and meaningful way, whether that's through social media reels or developing online courses, but online courses to teach other PTs how to start their own practices and things like that, because we don't get that education in school. But all in all, I just feel like it's super encouraging to see young professionals join the profession with the drive and passion which we are joining it with. And I hope that this creates a future where the general population truly knows what PT is and how it can change their lives. Because right now, most people really don't know what we do. I also hope we can create a future that where it's the normal to consider a DPT in the same category as other healthcare professionals, whether that's an MD, a dentist, or even a chiropractor. Because currently, for example, in Florida, after 30 days of direct access, chiropractors are one of the professions which can sign off on our plan of cares. And I simply just think that's because we're we're a younger profession and we just need to keep having the trust that we'll keep moving forward. But I just don't want to see a future where we're complaining, and I want to see a future where we're actually continuing to progress. And I think we'll get there. Humility is an important character trait. It is one of the most important character traits I can say. And I believe we all must strive to develop it, especially as physical therapists. I feel like sometimes it's misinterpreted as weakness, but to me, humility doesn't mean I think less of myself, but that I think of myself less often. So, therefore, it reminds me to be grateful for those who have helped me and helped me on my journey and helped me accomplish the things that I have so far and gotten me to this point in my life. And by doing those things for me, it helps my professional life because when I practice humility, I'm able to actively listen to my patients. It allows me to open my mind when I'm talking to them and, acknowledge the fact that they have just as much to teach me as I have to teach them. And to add to that, it actually helps me maintain my ambition and drive to challenge myself and continuously learn and grow because I understand that, I don't know it all and I never will, but that's okay. So, yeah, that's humility. But when you practice humility, being empathetic is pretty easy. So, to me, empathy is truly being able to put yourself in someone else's shoes. So, I have to ask myself, how would I feel if I was the patient sitting in front of me? And to really try my hardest to see things from their perspective. Obviously, as humans, we all see the world through our own lens based on whatever experiences we have. So we can just try our best to put ourselves in other people's shoes. But by actively listening and asking questions, it's definitely possible. But I feel like being able to do this is crucial in the PT profession and just in healthcare in general, because the best clinicians are the ones that are able to put themselves in their patient's shoes and see the person sitting in front of them as a whole person versus a diagnosis and consider all aspects to see where they're coming from. And honestly, patients notice when a practitioner is being empathetic, and it can really be the difference maker in getting that buy in and in helping that patient gain trust in your care. I've noticed I know that there's times where I'm not having the best week and maybe I let my personal life get in the way of a patient interaction, and it can really make or break it because when I am on my A game and I'm practicing the way I want to and I strive to, I'm usually the first person that could get information from a patient that other healthcare providers may have not gotten, just because the patient knows I'm there for them, listening to them for them, type of thing. Well, I guess I'll talk about why it exists first. So the gap is, by definition, just a paucity in care and resources. And I think the gap exists not because people don't want to help, but because we haven't effectively figured out a way to help. So I think, and I know I've been guilty of this as a student, but I feel like oftentimes we tend to play the blame game and we say that, oh, insurance is the problem and what have you, but we have to realize it's not that a solution exists and no one wants to bridge the gap. It's the fact that we haven't figured out an effective way to which keeps all parties involved happy. So personally, i I have to figure out a way to bridge the gap in a manner that positively impacts the government, patients, and even insurance companies as a whole. And the reason I believe that to be true is because if I'm able to understand that and acknowledge that, then I can actually accomplish the goal versus, I guess, living in a fairyland and thinking anything is possible, so to speak. Anything is possible, but if you consider all variables. So, personally, I plan to develop support groups, webinars, and hopefully a platform to serve as a resource for patients with neurological impairments who otherwise are unable to gain such knowledge or treatment or what have you due to their social status or income. But I also think one of the things that I'll do to help bridge this gap is teach other physical therapists and help them find their potential and be engaged in a path similar to the one I strive to pursue, because we all have something to offer our patients in our own way. And so if I can say something to another practitioner which can encourage them to go share their truth, then that would be amazing. So this is such a tricky one, and I'm still trying to figure it out, but I think that's okay. Um, because so currently, I short term wise, if I'm really trying to think about smart goals, I plan to continue working at either inpatient or outpatient neuro, where I'm completing my residency right now, to further fine tune my skills while I study for the NCS, which is in March 2023. But afterwards, I plan to go full time I plan to go full force into accomplishing bridging the gap and whatever other dreams that, that I've mentioned. Because since I'll be done with residency, I'll obviously have a lot more free time to pursue and spend time developing these things. And I'll finally be able to start learning more about what it takes to create those platforms and websites and all those things I spoke of. But all of the knowledge and skills and resources I gained throughout my residency would be the things kind of to help me get there. But I that would be the next step is now putting everything into action, everything I've learned. So first of all, I truly believe that as humans, we we can't be what we can't see. So oftentimes simply seeing someone as your same ethnicity or skin color in a position you dream of being in can flip the script in someone's mind and make it possible for them because now they've seen that it's possible. Um, so how I mentioned empathy before and how that's truly being able to put yourself in someone else's shoes. To me, by definition, diversity brings increased variety into the workforce. And as we all know, every patient's story and experience varies. So if we have increased diversity in the workforce, we'll not only bring out better patient outcomes and growth of various professionals due to like the unique experiences and variabilities that we'll have within our own workforce to connect to various patients, but it will allow younger generations to strive and continue progressing our profession where we left off because they would have seen that it's possible. I know personally, while growing up, um, not for any fault of theirs, but it was more, I was taught things like, oh, people like us can't have jobs like those. Just, that's how it was. And so being able to see that people like me can in fact have any type of jobs that they would like has been super encouraging and just especially as a child just showed me that it's possible, so I think it's of the utmost importance, especially in the PT profession where patients are opening up to us and we have to put ourselves in their shoes. It honestly means a great deal to me. I didn't realize how much it would mean to me actually until I got it. It's significantly impacted my self worth in a positive way and my self belief, I would say, just belief in that I can achieve something great. So not only do I now know that people like Heidi and Ifosa see something in me, but for the first time, I truly don't feel alone. Um, and speaking of the misconceived notions that, my parents would have maybe had perspectives about, such as people like us don't get jobs like those, I've realized that that was because they couldn't be what they couldn't see. And I'm grateful that the Rising Tide community is helping me open my eyes and see that anything is possible. I think more than anything, it's just it means the world to me to know that I'm not alone and that I'm supported and that someone else out there believes in me and what I have to offer.